So that leads right into the fourth concept, which is automated comprehensive screening. And this is actually what started the whole project, the idea of allowing people to test themselves in a convenient location. And these are asymptomatic subjects. These are not people with known eye disease. So it's very important that it's convenient for them to use this binocular system and get an immediate result. The projected screening time would be approximately 2 minutes. So actually the scanning time might only be 10 to 20 seconds. The instrument would then perform automated assessments and spit out the results immediately to the patient. In this case, it's not giving a diagnosis. It would provide a risk assessment for various areas in the eye, give you the names of physicians that specialize in those areas as well as their telephone numbers, and also an estimated time in which you should see them. For an urgent problem, it might say you need to see one of these doctors within the next week. And for a more stable problem, it might say you need to see one of these doctors within the next 6 months. So key features of this device are the fact that it's convenient. It can be made available 24 hours a day, 7 days a week, without pupillary dilation, just like an automated teller machine. So people who are busy with work schedules can use this machine at midnight or on weekends, at times when physicians might not be staffing clinics. It can be made accessible in pharmacies, malls, and even with the cost of this device could be so low that in fact many patients may be able to afford to purchase the instrument at home if we find that that's necessary. If the machine is fully automated, now the patient operates it and scans themselves and analyzes themselves. So you don't need an expensive photographer and physician that only work 9 to 5 hours to operate the instrument. And as I mentioned, the small binoculars built with existing technology should be cheap to manufacture and should be made affordable for subjects all around the world so that everyone can access this eye care. I also mentioned that quantitative methodologies may mean that there are advantages over current examination techniques and certainly advantages over current screening methods that tend to focus on one particular tissue area, such as screening for retinal disease or screening for optic nerve disease. And the immediate referral to specialists is important since many patients, when they leave the clinic, you can't get back in touch with them. So, in summary, we feel that this is a novel device based on a single technology. This is only OCT within these binoculars, no other imaging modalities at all, which makes it less expensive. I think that platform offers new possibilities for reinventing the way that we examine the eye and re-engineering the way that we practice ophthalmology. We really strongly feel that this instrument could decrease the cost of care, increase the efficiency of care, and improve the quality of ophthalmic care all around the world. It has not been built, and so there's no guarantee that it will work. But as I said in the beginning, we hope that this will stimulate dialogue, inspire people to think differently about the way we examine the eye, and hopefully encourage people to present alternatives that may be better than this instrument, because we feel that we need more efficient and quantitative techniques to bring ophthalmology into the 21st century. Thank you very much for listening to the talk.